First Choice Home Care Services Nursing Home Transition and Diversion, NHTD, and Traumatic Brain Injury, TBI, waiver programs. Annual training. Basic training. Service-specific training. Nursing Home Transition and Diversion, NHTD, and Traumatic Brain Injury, TBI, waiver programs overview. To increase the knowledge of waiver service providers and other interested parties concerning the development of Medicaid waivers, the philosophy and intent of the NHTD/TBI waiver participant rights and responsibilities, the roles and responsibilities of program staff, and program policies and procedures. Objectives: by the end of the training participants will be able to discuss the philosophy of the NHTD/TBI waiver programs, identify the rights and responsibilities of waiver participants, describe the importance of the team approach to service provision, identify effective methods and interventions to provide support and supervision for waiver participants, recognize the need for basic safety and emergency procedure including crisis intervention, recognize the need for incident reporting. What is Medicaid? Health insurance program. What does it cover? What is a waiver program? Agreement between NYS and federal government that the state can use Medicaid for services not covered under state plan. Current societal goals. People with disabilities have right to least restrictive setting, Olmstead decision, aging in home is preferred to institutionalization. Purpose of waivers. Provide an alternative to institutionalization. Must be cost neutral, doesn't cost more than institutionalization based on average cost of waiver versus average cost of institutional care. Waiver philosophy. Individual is the primary decision maker. Dignity of risk and the right to fail. Waiver services are provided based on participants' unique strengths, needs, choices, goals. Health and welfare. Waiver philosophy, continued. The individual planning with providers leads to personal empowerment, independence, community inclusion, self-reliance, meaningful activities. Waiver participants. Nursing Home Transition and Diversion, NHTD, program and Traumatic Brain Injury, TBI, programs. Is driving force of all services, sets own personal goals, develops the service plans with the service coordinator, has freedom of choice, including choice of waiver services and providers. Waiver participants, continued. May have a spinal cord injury, stroke, a progressive disease such as Alzheimer's or MS, may be elderly and frail. Waiver participants, continued. May have cognitive issues, challenges with thinking, physical issues, challenges with ADL/IADL, behavioral issues, challenges with acting. Rights and responsibilities. Rights for the participants. Partnership between participants and providers means participants have responsibilities. Waiver principles, participant-driven. Participant choice. Self-determination. Assure health and welfare of participant. Cost neutrality. Supporting informal caregivers. The participant is driving force of all services. Sets own personal goals. Develops the service plans with the service coordinator. Has freedom of choice, including choice of waiver services and providers. There are two types of waiver programs: Nursing Home Transition and Diversion, NHTD. Traumatic Brain Injury, TBI. NHTD service philosophy. Services are provided on an individual basis. A program participant may have one or all the outlined NHTD waiver services, dependent on need and necessity at the time. Services are meant to be fluid and to flow with the program participant's life needs. Traumatic brain injury, TBI. A brain injury is any injury that results in brain cell death and loss of function. Traumatic brain injury, TBI, is caused by an external trauma to the head or violent movement of the head, such as from a fall, car crash or being shaken. TBI may or may not be combined with loss of consciousness, an open wound or skull fracture. TBI service philosophy. Individual is the primary decision maker. Dignity of risk and the right to fail. Support of the person's right to choose where to live, who to live with and socialize with, and what goals and activities to pursue. Tips for working with individuals with brain injury. Consistency is important. Treat the individual as an adult. Be patient. Model calm and controlled behavior yourself. Expect the unexpected. Always remember, people with brain injuries are more sensitive to stress. Environmental support. Make and change beds unoccupied or occupied. Dusting and vacuuming rooms used by participants. Light cleaning of kitchen, bedroom, bathroom. Dishwashing. Listing needed supplies. Shopping. Laundering, mending, ironing. Payment of bills and other errands. Nutritional support. Develop menu. Prepare grocery list. Grocery shopping. Prepare meals. Assist with feeding. Measure and record intake. Personal care functions. Bathing. Skin care. Toileting. Grooming. Walking. Using medical supplies and equipment. Assisting with the self-administration of medication. Communication. Communication do's and don'ts. Do's. Do be accepting. Do take every issue seriously. Do address people age appropriately. Do convey respect. Do assist them in problem solving. Do state relevant facts to those that needs to know. Do remember that you don't know how they feel. Do be their equal. Do be sincere. Don'ts. Don't be blame/fault finding. Don't ignore an issue. Don't talk down to anyone. Don't patronize. Don't take responsibility for their situations. Don't gossip. Avoid saying things like I know, and I know how you feel. Don't make promises you can't keep. Avoid domination. Observe, record, and report. Significant changes in eating/drinking. Weight. Ability, cognitive, physical. Alertness. Energy level. Behavior. Observe, record and report, continued. Any significant changes in the individual must be reported immediately to your supervisor and/or service coordinator. Must be documented in service notes. What is a crisis situation? Natural disasters. Severe weather. Medical emergency. Fire. Behavioral crisis. Mental health crisis. Power blackouts. What to do in a crisis. Define the crisis situation. Contact your supervisor, do not do it alone, know your agency's policies. Dial 911, if warranted. Take steps to ensure the immediate safety of the participant, others in the area and yourself. What to do in a crisis. Continued. Know your agency's policy, procedures and protocol for. When to call a supervisor or agency's administrator on call. When to call 911. When to call the police. What to do in a crisis. Continued. Every participant has a plan of protective oversight. Reviewed and updated by service coordinator and participant at least every 6 months. Outlines basic information for the participant's overall health and welfare. What to do in a crisis. Continued. Be familiar, in advance, with the individual's plan of protective oversight. Individual's plan for medication administration and monitoring. Any other necessary medical needs, devices and/or life-sustaining treatments. Individual's ability to get out of home in an emergency. Patient's rights and responsibilities. Waiver participants are assured certain rights, and must agree to certain responsibilities related to participation in the waiver program. Patient's rights and responsibilities continue. The service coordinator is responsible for explaining to the waiver applicant/participant the rights and responsibilities of being a waiver participant. These rights and responsibilities should be reviewed with the participant at least annually, and any time the service coordinator is aware that the participant does not understand his/her rights or responsibilities. The TBI and NHTD are participants' choice programs. Remember at all times, the participant must make the choice, and it is the HCSS responsibility to ensure that their choices are safe. The HCSS is responsible for maintaining oversight and supervision at all times while servicing the participant.